Hello, everybody. My name is John McDonough. I'm with the Harvard T.H. Chan School of Public Health, and I'm joined by my colleague, Dr. Paul Haddis from the Tufts University School of Medicine, and this is Health or Consequences, the regular podcast on health policy in Massachusetts, sponsored by CommonWealth Magazine and Mass Inc. Today we are delighted to welcome back for a return performance, I think this may be our first repeat, Senator Cindy Friedman, a state senator from the Arlington-Lexington State Senate District. And she is in her first term and is a candidate for re-election. Most importantly, in her second term, forgive me, and is currently the Senate co-chair of the Joint Committee on Healthcare Financing. And she is deeply in the middle of all of the health policy issues going on in the state. And we thought it would be a great opportunity to check in with Senator Friedman in terms of how she's doing, how she perceives the state is doing, how the Senate is doing in the midst of this incredible pandemic we're living through right now. So welcome, Senator Friedman. Thanks for coming back to us.
Hi, John. Hi, Paul. It's great to hear you guys. And I'm happy to be here.
Thank you. And so let's just start with, what's it like being a state senator in the midst of this historically unprecedented pandemic? How are you and your colleagues holding up? What's it like? Can you run a re-election campaign? What's it all like? What's happening now as far as you can see day to day?
Well, I would think it's similar to what a lot of people are feeling, and that is this incredible sense of unreality, of something that just never experienced before. I've learned a whole lot about working at home. I've learned a whole lot about communication and what works and what doesn't. I've certainly learned a whole lot about how interconnected every single thing is in our lives. I mean, we forget, we just take so much for granted. And then when reality changes, you just realize how dependent we are on so many things and so many people. And, being a state senator, I really see all of that. And I see how important it is that we all work together and we all come to the table at least with the same set of the same willingness to try and solve problems that we've just never had to deal with before. I think we're all holding up okay. I get up every morning and just thank whoever for the life I have and the privileges that I have and my ability to social distance and keep my job and realize how many people that's just not an option for. So am I holding up? When I think about other people in the Commonwealth and the country, I am just fine.
And are you running a actual re-election campaign now, or is that all off to the side while we're in the midst of this?
I have not thought of re-election since March 1st, and not because I don't take it seriously, but because we're just so focused on getting through the pandemic. And it's just really hard to think about running a campaign.
Okay.
It's important, but it seems so unimportant when so much real stuff is going on.
Let me turn it over to my colleague, Paul.
Senator, let me add my words of welcome and certainly appreciate you and your colleagues' efforts to try to do your job on behalf of all of us during the pandemic. And actually, the legislature has been active in relationship even to COVID-19 over these past few months. Can you tell us a little bit about what it is that the legislature has done and you and your Joint Healthcare Financing Committee in particular, and I know you're operating now without a permanent House co-chair. So what has been before you in the last couple of months?
Well, actually, I was looking over what we've been doing as part of this pandemic in the legislature, and we've actually done quite a bit. just so we did a notarization bill that allowed people to do remote notarizing, which is incredibly important for people to get, real estate transactions and wills and things like that, affidavits, trusts, that kind of thing. So we passed that, the remote notarization bill. We passed a moratorium on non-essential evictions and foreclosures to protect people during this time from being evicted or having their houses foreclosed on them. We did a liability protection bill so that healthcare workers and doctors who were not currently in practice could come back and help out with the pandemic. We've done a couple of municipal bills, things that allowed cities and towns to do partial budgets, to deal with town meeting, to go remote when they needed to. We waived the MCAS requirements. So we did a small recovery business loan for $10 million. We also gave a $15 million SUP that allowed, that gave money to local boards of health. I know the Senate also was working on passed a bill that protected people's SNAP benefits so that you could apply for SNAP even though your assets may be more than currently is allowed. So people who lost their jobs but need help with food would get it. Those are some of the things we've done. We did a scope of practice bill in the Senate. We did a telehealth bill, which both of those turned out that the governor did through executive order, but we did them in the Senate, so they were ready to go. So those are some of the things. So we've been really busy. I miss my co-chair. It was good. We had a great relationship. The vice chair is now, we've been working to get our bills out. We have a number of bills that we have to get out that have been an extension. So we'll be doing that. But I guess I've been more focused on working with the administration right now over the past couple of months around hospitals, access to care, PPE, those kinds of things, and budget.
So Senator, before the pandemic emerged and took over everything on the policy agenda, Governor Baker had introduced last year an ambitious health reform bill on behavioral health and primary care. The state Senate has passed some ambitious bills on rising prescription drug costs and on behavioral health. The House hasn't acted on either of them. In light of the situation in terms of where we are right now, and with only a few months left until the end of July recess, with the budget still yet to be done, is there any possibility that we might see action on any of those initiatives that people were so focused on pre-pandemic?
I think the honest answer to that is, I don't know. Are we going to go longer because we feel like we've lost a lot of time because we've been completely sidetracked by this? Can we go longer as a legislature and do more, do more things? I think we're going to have some issues before us, not the least of the budget, that may have us going longer than July. And if that's the case, then I certainly will push to get, the mental health bill and the prescription drug bill out, because those become more important every day, right? I mean, mental health is going to be more of an issue than it was before the pandemic. It's not going to be less. I think we are all waiting for a mental health surge because lots of people have not gotten the care that they need. And this has put an enormous amount of stress on families and children in a way that is really going to have an effect on people and their ability to recover. So we're going to need all of that. We need it desperately. We needed it before we started, and we're going to need it even more. So, and the prescription drug issue is still the prescription drug issue. And maybe even that's more of an issue, because there are a lot of people now that are that are in really reduced financial circumstances, and they're going to need relief from their medications, relief from the cost of those. We know they were rising exponentially, and we got to make sure that they have access. And so to me, those become every bit as important, maybe more than they were before we started.
Have you been given, Senator, any indication of how the budget is going to get done and a timetable or anything like that? Or is it a mystery, as they say?
I would call it a ongoing discussion. It's clear that we can't do the budget the way we normally do the budget. The House can't do it for a month and then the Senate do it for a month and then we get together and reconcile our differences. So I know there's conversations going on. And I know that there's discussion about, do we do a partial budget and then go forward? I mean, part of, I think, the issue in defense of the legislature is we don't know what's coming in terms of federal aid. And that is going to be absolutely crucial to us. If we don't get federal aid, we will see cuts that we've just never seen before, that will affect every single part of our Commonwealth. If we do get federal aid, what is that federal aid and how is it applied? We don't know that yet. So doing a budget right now is really challenging, especially when we're being told something's coming. So I think it is a mystery because there's so much unknown. I don't think people are keeping something from us. I just think we just don't know yet.
Paul?
Senator, turning to the pandemic, sadly, we're part of a subset of states where over half the deaths have occurred in nursing home patients in the Commonwealth. And a lot of folks are worried about that. The governor, with his worry, and of Secretary Sutters, have offered up $130 million of Medicaid dollars to help support those nursing homes. What's your thought about the problem and the response?
I think what we are seeing is an industry that was on or near the verge of collapse, and it is collapsing. And I think what the administration has done, what the command center has done, is all of the right things to do. You can argue whether it was, didn't happen fast enough or it isn't enough, but what they're doing right now is what needs to happen. It is a huge issue, and it is extremely complicated. And what we're seeing is years of, big companies coming in and buying nursing homes that have no connection to the community that nursing home is in. Nursing homes used to be all, mom and pop local. Now they're run by people in New Jersey and Texas. They don't know from Massachusetts. It's a workforce that has been drastically underpaid for the work that they do. These people have 2 jobs, 3 jobs. They go from one nursing home to another. What did we expect? The nursing homes have never been in the business of intense infection control, right? It's just not in their bailiwick. And these, remember, are the most vulnerable people. Many people in nursing homes go there for their end-of-life care. So all of this coming together has just created this, I'm trying not to use that word, the storm that we're seeing the results of.
And the worry, of course, is that assisted living and other senior housing are just behind them potentially, and already infections. So it's really seniors as one of the vulnerable groups that are really on the line here.
Right. And people that go to there's the part of long-term care that is people that, that's where they live. And then there are people coming in for rehab and skilled nursing, and they're coming from hospitals, and those hospitals may have had infections. So it's just, it's not sustainable. And I think that what we really need to look at is how do we provide care where we need it, and make sure that the right procedures are in place, that we have serious requirements for taking care of people, and that we increase the pay of our workforce, because people need to be able to come and work there and have one job and be able to earn a living wage.
Well, let me move from the nursing homes to the broader array of providers, where a lot of the frontline folks are seeing patients who are sick, including with COVID-19. But there, I want to ask you more of a financial stability question. Some of our community hospitals, some of our neighborhood health centers, especially those that are independent, a lot of physician practices, especially when you get to the smaller ones outside of the Boston area, they're all having financial stability concerns because of the drop in volume. There's been federal and state monies have come forward to try to help those providers. But what worries you the most right now about the financial issues confronting those groups?
What worries me the most is that the institutions that have been, stable and solid and far-reaching are going to be okay, and the institutions that serve the most vulnerable, the poor, the minorities who have been struggling are going to either continue to struggle or they're going to get wiped out. I mean, I think that's what it comes down to. And we have to really we have to put our money where our mouth is. If we really believe in taking care of the most vulnerable in our society, if we want to make sure that access is equal, we have to make some very hard choices, and we have to make sure that we're putting the resources where where they're most needed. Does Lawrence, that serves a huge population of people in an area, do we need to shore them up? Absolutely. Do we have to make sure that they can do the job they're there to do? Absolutely. Is there another hospital in another part of the state that's 2 minutes away from another hospital, and they're doing the same kinds of things, and they have the same services? And are we putting money in both of those? Does that make sense? I don't know. We got to figure that out, because there are limited resources, and we want everybody to pay their share, but we really have to make sure that the way we're delivering care is efficient and is working for the people that we're delivering care to, and not to, institutions and keeping things running for the sake of keeping them running, and, and trying to do more than we can do. And, I hope that makes sense, but it's like, what do we need and where do we need it? And we have to make those decisions. And if nothing has shown us, if we have learned nothing from this, we have to learn how fragile that healthcare system is and how difficult it is to deliver care where it's needed.
I wonder if I could dig into one of the groups for a moment. Primary care doctors, who many of whom saying, they're, even with telehealth, their revenues are down substantially. And some of them are coming up with the concept of saying, gee, isn't this the time maybe to push the insurers, maybe Medicaid too, into more of a capitated payment for them, rather than basing it on just fee-for-service volume as a way of having regular flow. Any thought about that particular issue?
I think it absolutely makes sense. I think the devil's in the detail, right? I mean, we've set up these ACOs in Medicaid, but in fact, they're sort of based on a fee-for-service model, right? And that's
Right.
how we measure whether you're keeping within your capitation, or your capitation is. I mean, those are the measurements that we use, and that's not going to work. I absolutely support a capitated model, especially in primary care. We have to make sure that we set that capitation right, that it does reflect what it costs to take care of a whole person, and not so the quality of the care has to come first, and then how much it costs has to come next, as opposed to how much can we pay for this, so this is what you get to do, which we often do in healthcare and a lot of other things. So, but I think it's absolutely the right way to go. I think in a perfect world, we would have incredibly strong primary care and behavioral health integrated. We would have really robust community health centers. And then we would have hospitals that do what hospitals ought to do, and that's take care of the really, the sickest and the sort of most specialized needs. That's the picture of the world that I think we should be building. One could only hope.
Thank you. Senator, are you satisfied with the extent to which the state has adequate supplies for personal protective equipment and testing and those other essentials for healthcare workers and first responders in the state right now? Or do you have concerns about that? How big a problem is that, or is that not a problem from what you're able to understand and see?
So this is kind of what I was talking a little bit about when you look at the interconnectedness. And I think this is what we've seen here is a perfect example of the downside of a global economy, right? I am really worried about PPE and testing supplies, and I think we all should be, especially as we open up the Commonwealth to business. We don't make anything anymore in these areas. We get none of these supplies or PPEs come from the United States. And when the countries that you depend on get hit by a pandemic, you learn that you can no longer get those things. And that's what we're seeing. And I think the Commonwealth has done a good job in doing the hard work of finding these things and getting people to supply them. But we have a long way to go. And if we're going to open up our system, we have to be sure that the PPE is in place. And I'm really concerned that, I'm not worried about the big institutions and the big companies. They have a lot of buying power. They'll figure out a way to get PPE. I'm really worried about the smaller businesses and, Bob's Auto Body or Deborah's Diner, who needs to be in business but doesn't have the buying power that a Fidelity or a Raytheon or whoever has. So I am really worried about it. And in terms of the testing, I think from everything I've read and what people are saying, I think we really need to advance our ability to test, not only by getting the supplies for the tests that we have now, but for actually developing tests that people can do themselves or that are much easier to administer. I think this is going to be a real barrier to people getting tests. Right now we have a test that has to be administered by somebody who really knows what they're doing. It's a very long 12-inch swab that goes up your nose and is extremely uncomfortable. Requires that that it be put in the right place, that it be packaged correctly. There's so many challenges to giving that test. We really need better tests and more of them. So I applaud and I support all of the work that different institutions are doing to come up with a better test. Because when we do that, then I think we're going to reduce a barrier that's really important to us getting back on track.
Great. Thank you. Paul?
Across the country, disproportionate impacts of COVID-19 on various populations. We've talked about the nursing home population, but people who are incarcerated, those who live in dense urban areas, often that includes high infection rates and sadly death rates in racial and ethnic minorities and other disadvantaged populations. What are the impacts that's happening to these groups that you're seeing right now? And what do you think we ought to be doing about addressing those issues?
Well, I think that we have what we're seeing again is years and years and years of social inequities. And we are seeing the results of the social determinants of health. They're coming out starkly, and if we weren't clear about what it means to be poor and sick in the United States, we sure have learned it now. What I am looking for, because we can't solve those problems in this moment, they're many, many years and decades in the making. What I really want us all to focus on is, as we get back to work and as we come up with a plan, that there is laser focused on how we support those communities, how we support urban communities, how we support people in communities who don't have the luxury of working at home and social distancing and need to get back to work, and we need them desperately to get back to work. So our focus should be, how do you protect those people? How do you protect them in the businesses that they go back to? And we better be putting our resources in those areas, into the Chelseas and the Everetts and the Brocktons and the Hollyoaks, and places where people live, where it's dense, where it's lower income, and where they do work that we are absolutely 100% dependent on them getting to those jobs. So that's what I'll be looking for.
Thank you.
So, Senator, everybody seems to have an opinion about the job performance of President Trump in this crisis, either for or against. How would you assess the performance of Governor Charlie Baker and his administration in their role in taking the state through this unprecedented crisis?
Well, let me put it this way. Raise your hand if you want to be the governor right now. I've worked a lot with the command center over the past 2 months, quite a bit with the command center. And I have to say that what I have experienced are a group of people who care very, very deeply, who have been put into incredible situations, having to make very difficult choices for systems that have long been neglected, where there is not a lot of infrastructure, and they've had to put it all together really fast. And I think, given what their challenges have been, they have done an amazing job. And I think what I find most, not rewarding, but I find most comforting is that I have met very, very little ego, hubris. It's just people who are working. I don't know how they can work that hard. They're working hard. They care very, very much. And they're trying to do the right thing, and they're always willing to listen. And I think that is, if I could ask for anything, I think that's what I would ask for. And they're smart. So I think overall, while there are things I don't agree with, and while I might have done some things, I might do some things differently, I don't think it's out of any malice or, not caring or anything like that. So I think we're very, very lucky. And I'm really, really, really grateful for the bipartisan effort that has all gone into this, that, the politicians can all get together and say, no, me, no, I need to do it. There's been very little of that, especially in my dealings. It's like, who's going to do this? You do it, go do it. And I'm really, really grateful for living in the state.
So, Senator, final question. As one of the state's key policy leaders, particularly on health policy, do you have a message for your own constituents and for the citizens of the state about this current crisis that would be really important for them to keep in mind for however long it's going to take us to get to the other side of this?
I don't know how important it is, John and Paul, my particular take on this, but here's how I think about it. First of all, leadership really matters. And having leaders from the very top to our state, to our communities, to our localities, having leaders really who care about this and who are willing to do the work and who are thoughtful really matters. And this should be a lesson to all of us, that we need to vote, and that we need to make sure that there are people in positions who can help us through these kinds of situations. I fear there's going to be more like this. But the second thing is, the health leaders are coming together And we're going to work really hard to make a smooth transition from where we are to where we need to be. But we need everybody's help. We need to find a way for us to be patient, and we need to make sure that we can stick together and that we work together. Because if we do that, we will get through it. If we start from a position of opposition, of not trusting, of thinking only of ourselves, we won't get through it. But if we can keep this patience that people have had, this incredible understanding that I've seen from so many people, people in my district calling me up and saying, I need to work, but I understand that this is a really hard thing for the state to do. How can we do this? As long as that's our attitude, I know it may sound silly or corny, but we will get through it together if we work together. If we start going at each other, we can't get through this. So be patient, stick together, help each other, and we will get through this.
Senator Friedman, that's a touching philosophical note to end this conversation with you. We so appreciate you joining us at this time, and we really look forward to our next conversation. Hopefully we could all be safely together, and society can be able to be closer back to its normal function as well. So thank you very much for your time.
Well, thank you both. I think about you both as people who paved this path for us. And I think I've had a lot to do with what this state is and the incredible value that our healthcare system gives. So thank you.